So biopsy and FNAC are two most commonly done tests to confirm cancer or malignancy or to take tissue from a suspected area. So both of these tests are somewhat similar except a few differences. So generally biopsy it involves taking a little bit more amount of tissue or a chunk of tissue from a suspected area. Whereas FNAC, the name itself says fine needle aspiration cytology, wherein a small sample of the tissue is collected by a thin small needle. So the sample obtained from biopsy is a little bit bigger sample, whereas from FNAC it is a very very small amount of sample. But the advantage of FNAC is that it is a very easy procedure. It can be done on an OP basis, and the results are also fast. Within a day or two, we obtain the results. Whereas biopsy, most of the biopsies can be done in the OPD basis, such as biopsies of the cervix or breast or superficial skin ulcerations or any ulcers. In those cases, biopsy can be done in OPD basis also. Whereas in some cases in which the tumor is deep seated, maybe it is in the throat or behind the oral cavity or in the nasopharynx, in those cases, the patient might have to get admitted either in daycare basis or on an OPD or an IPD basis. In those cases, also anesthesia will be required. Whereas in most of the cases, a small local anesthesia, short anesthesia is generally given. So the report of biopsy generally takes about 4 to 5 days. So once biopsy and FNAC is obtained, it is sent to the pathology lab wherein they see under the microscope. Because a biopsy sample is a bigger sample, so it takes time. It takes 3 to 4 days for the entire thing to process. So generally, both are very safe procedures without any side effects. Soon after the procedure, you may experience a little bit of pain or a little bit of a tingling sensation. Apart from that, both are commonly done procedures in all oncology centers, and it is a very very easy and common procedure.